universities and how we would not have our scientific universities if it were not for Vienna, Berlin, and likely Zurich and Bern as well. Following my Iowa City training, where we were trained to do more watching and not so much operating, I went to the Hospital for Sick Children in Toronto, where there was a great deal of surgery. So I sort of have a view from two angles regarding when and how we should intervene in childhood disease. This was reported by Reuters several years ago, and it kind of caught my eye. It said half of babies born in the rich world will live to 100 years. And then the National Geographic came out in 2013 and then said that was radically underestimated and said that most babies now will live to 120 years in the advanced world. The reasons traditionally are well known, but genetics is coming in, and genetics is probably more of a factor than one might think in musculoskeletal disease and even perhaps a lack of offset hip. Science is the reason for this, new technology being invented at an exponential rate, and what Klaus Schwab of the World Economic Forum calls the fourth industrial revolution related to these chips and developing drugs, implants, methods, seminars, operative approaches that are so advanced that we're not sure when they should be applied. So there are old norms regarding these diseases and new ones that are evolving before our eyes. The standards of treatment have been oriented toward function in childhood, but we realize now that many people will live for a very long age and are very interested in what their hip will be like at 80 and 90. So modern expectations differ. Parents have very different ideas about the perfection that we can achieve, and we have many times and places where we can intervene, as we've seen in this conference, but we're not quite always certain whether we should. Human development has been slow. Said from 1300 before the Common Era to 1300 CE, there was very little change in how humans functioned. And then there were revolutions, first the printing press, scientific thinking, the Renaissance in Europe, and the Renaissance certainly and quickly affected medicine, with Nicolas André being the person who gave us guidance regarding how children should be raised. This is the very long title interpreted from the French, but it basically is bringing the idea that parents desire to have perfect children, and there's things that you can do to help them have better posture. He said children that were not knock-kneed and sat straight at their desk were more likely to marry into a better class of family. So he sort of pushed the idea of human perfection. But we didn't have very many ways to actually change this other than sitting straight in your chair. But we think perhaps Nicolas André to some extent anticipated and put us in our current dilemma, because we can do so much, but we do not know whether we should. Orthopedic care in Europe, and as transplanted to Iowa to a great extent, was safely conservative when only non-operative care could be provided. Then the onset of science, its application to surgery. The German invention of the X-ray suddenly allowed us to understand orthopedic disease. People complain that their new total hip or their new idea doesn't spread fast enough. But after this lecture was given in Würzburg, within about 4 months there were X-ray machines in all the major teaching cities of Europe. So when a true advance comes, don't worry, the people will find it. Because you think it's a great advancement, it's different from whether the culture finds that. So orthopedic advances led to high-quality research and a sophisticated number of implants for the adult orthopedic world. But up until recently, children's orthopedics was left out of this a little bit. There weren't so many things, but this is changing now. We're suddenly finding implants that can be used in almost every area of the human body. And we seem to be getting more residents interested in children's orthopedics because they finally get to do lots of implants and do surgery. And so we have a form of orthopedic bioengineering that has evolved with new surgical standards and methods that allow us to implement Nicolas André's philosophy that the human body can predictably be improved. And the parents agree with him that they should have a perfect child. They want it to be within one standard deviation of perfection. And particularly, they'd like it to be good in sports, but we don't know whether we should do it. So a few conditions: hip disorders, angular problems, and sports for children. Hip disorders we spent quite a bit of time on and understanding of how they should be treated. And my background and view was oriented, as Stuart Weinstein had said, toward these conditions. Followed carefully over almost a generation of time. It said minimum treat the children could do well until age 50. But just 100 years ago, the average lifespan in America was about 55, so this was about enough. And so all conditions, it's felt, really might not require too aggressive of treatment because the patient could live a reasonably normal life, but we weren't predicting how long that life would be. So now we have understanding in conditions like slips. If we studied it in Iowa, it was said that with simple treatment, without anything too complex, we could have a satisfactory outcome. Strange things happen in slips. Tourette was mentioned by Weinstein recently regarding the study and the development and decay of the human frame. But the development of human retroversion in children, because they eat too much, is a rapid speed up of evolutionary change in humans, because these children are probably anteverted when they're 5. And their family moves next to a McDonald's store, and over time they become retroverted, putting the proximal femoral physis in a position that will likely slip. But we had simple treatments in a simpler era, and it was seen that these patients primarily could do well. They somehow figured out a way to remodel and reorganize their proximal hip in a relatively functional level in a large percentage of cases. But new literature, new activity, new types of humans, sports-oriented, vigorous, dynamic in how they use their frame, has suggested this is not true in many cases. So we have very good new understanding and sophisticated understanding that have developed in centers such as this. The lack of offset hip, the sense of whether this is some type of rotational growth disturbance due to activity. We call this the athletic child hip. We talked about whether or not you should prevent your child from having occupational hazard or injury, and the treatment is there. Recontouring can be done via scope, as we have learned. And professional baseball players earn many more millions of dollars by having this done and then resuming their sport. But the problem is, we're having more and more surgeons with the skill and more borderline patients come to their office, such as teenage athletes, particularly females, who may be competing at the highest level with the issue of knee injuries and hip problems. And so we have interesting complex surgery, but how normal can we make the hip? And most importantly, in what patient should we tell them to change their sport from a cutting and twisting sport to a straightforward sport versus carving on their femoral head and telling them they can return to the condition or the activity that perhaps caused their problem. Angular and rotational problems are well known. We know when diseases cause them, inherited diseases. Physiologic genu varum almost always corrects. Genu valgum, I was trained that this almost always corrects as well, till I saw this wonderful mother and grandmother who came to my office, and I spent about 10 minutes explaining how the genu valgum in their 12-year-old boy would improve over time. Then she pulled out an envelope with pictures over 5 generations of her family, that everyone maintained this genu valgum and had arthritis. So I shut my mouth and went on. So we know these children have awkward gait, poor coordination, patellar malalignment, sometimes external tibial torsion. A few patients in North America had stapling done, because Walter Blount promoted this idea, which was originally German, that you could easily correct the physis and correct genu valgum. This is now much easier and very commonly done in thousands of North American children because a new implant has been developed and promoted. But the problem is we're not quite sure when, where, and how we should treat these children. Nicholas Andre, the parents, want us to get this child straight. We have disappointed parents, and I can tell you, if you correct the genu valgum of one member of an American, or a soccer team in America, as we call it, several of their teammates will be there in the next year to have their limbs straightened out. They all believe it will be Ronaldo, but it may not. So we say, no worry, modern surgery can normalize your patient. But this is a typical dilemma we're in. 9-year-old Hispanic female in California. If you're athletic, your goal is to play on the Mexican World Cup team. Because if you have a Mexican surname, you can play for their national team. And so they come to see us. Their brothers are great in soccer. They want to be greater. So we can do this. 1 year later, what do we have? We have a little male with straight, slightly varus knees. We allow them to overcorrect because you get some rebound. And so she's going to go off and be a championship soccer player. The parents think she's better, but at what cost? And could this be affecting her hips? The wider pelvis in a female leads to some need for some genu valgum, and if we overcorrect them, perhaps the reverse of what Dr. Chen said early in this meeting, there may be an effect between the knee and hip that we don't understand. The most complex area that we're faced with now has already been implied, and that is overuse syndromes in children. Sports in America, and I'm sure in Europe among the privileged class or those with adequate income, includes a tremendous amount of time and money, and eventually overuse in trying to achieve perfection. Malcolm Gladwell, the Canadian philosopher-writer, said it takes 10,000 hours to learn anything, how to play a violin, how to throw a baseball, or probably how to do an orthopedic operation. We have this movement toward training in very early childhood. This is from California, showing a 19-month-old boy in a soccer class, which his parents pay good money for. I have two brothers who are veterinary surgeons, and they bring some sense to what I do. And they referred me to this text regarding over-childhood activity. This is the Smithsonian book describing each breed of dog and how they should be cared for. And what it says for the Irish Wolfhound is on the left. An Irish Wolfhound pup should not be taken on long walks, as these can damage their joints. Instead, they should be encouraged to run and play at their own chosen pace. How many human children are given this practical advice? And if they were, would they require less hip recontouring as teenagers? Risky sports, of course, are present, and the parental demands on children's orthopedists are great. Reconstruct the anterior cruciate ligament, even though the physes are open. Repair any injury with surgery. And we really have made tremendous advances from this organization. I'm so happy Weinstein could be here to sort of share with what's going on in this young adult group. And there are many new methods that we use every week, and we help teenagers a lot. And in a typical case, it's easy. But there are many ways to actually help and improve a child, and hip preservation surgery is not simply recarving on the femoral head. There are other areas to do it, as you saw here, femoral head reduction. In San Diego, it's quite common to do allografts, major allografts in the joint. It's a major area of surgery, and so a patient like this, suffering from a femoral neck fracture with AVN, might have a femoral head allograft, hand varus osteotomy, different treatments. So there are a wide, broad area of hip preservation surgery that may be needed. Total hips are better, and so we're faced in our circumstance of deciding, should we do a repeat hip recontouring, or should they have a total hip? And this is a very aggressive athlete who had a femoral neck fracture. And we told him how careful he should be for at least 1 year after his resurfacing arthroplasty. The parents brought in this video of him dunking basketballs taken 6 weeks after his operation. This is called risk homeostasis. Children really don't want to be safe, and they don't want to protect their limbs, and you have to control them a bit. We now have 20 patients under age 20 years who've had total hip replacements. Our total hip surgeons are becoming more vigorous in the severe hip in doing this. It seems to be a good procedure, but we're really not always sure where it should be done. So in summary, children's orthopedics faces many questions in adapting to the scientific revolution. A current infant may live to 2113 or maybe 2133. Decisions on how we treat are expensive when we should have prospective treatment protocols. National studies are a cost-benefit ratio and the best choice for the greater good. Where advances in treatment really outpace our ability to study them. And I really have to credit the anchor group, the group here and other places that are trying to get the scientific analysis out before we move on to the next idea. In our medical center, the idea is brought up that the outcome data for the group may be less and less valuable as we move toward molecular medicine. That every patient's cartilage, their molecular structure, perhaps whether or not they will develop a lack of offset hip, may be related on a molecular basis. This is one of the directors of a program in our center that says, evidence-based medicine move over. Sophisticated families want to know exactly what should be done for their child. Not for a group of 120, because they don't know what the genetics of their child fits in the 120 patients that have been reported. Companies like Illumina are bringing the total DNA dissection down to $1,000 rather than $10,000. And I think soon we will have ideas developed related to individual understanding of genetics regarding what treatment methods should be used, whether the quality of the articular cartilage would withstand certain types of operations. And so there's plenty of room for improvement, but also a fair area of confusion as we live through this rapid progressing era. Thank you.